This is a round 2. We've made a lot of progress from round 1. We're going to further slenderize or make the waist smaller with ribs and additional lipo, re-expand the thighs. So really what we're doing here is improving the waist to hip ratio.
I get those goosebumps every time. I need the hype. Throw that to the side. I get those goosebumps every time. Yeah, when you're not around me, throw that to the side. I get those goosebumps every time. I need the hype. Throw that to the side. I get those goosebumps.
Full body lipo. Round 2, we're going to lipo from the upper back to the waist. She has the great shape. When we compare the pre-op photos from before first surgery, you'll see a huge change. What we're doing today is going to further modify or bring in the waist by doing both liposuction with rib remodeling. Additionally, we're going to re-expand the buttock and hips. So really what we're doing is improving the waist to hip ratio. We're also going to be showing you a photo of her CAT scan so we can see some of the rib anatomy as well.
I get those goosebumps every time, yeah. You come around, yeah. You ease my mind, you make everything feel fine. Worry about those comments, I'm way too numb, yeah. It's way too dumb, yeah. I get those goosebumps every time. I need the Heimlich, throw that to the side, yeah. I get those goosebumps every time, yeah. When you're not around, when you throw that to the side, yeah. I get those goosebumps every time, yeah. 713, it's way when you're I get those goosebumps every time. I get those goosebumps every time. I get those goosebumps every time. I need the hype. Throw that to the side. I get those goosebumps every time. Yeah, when you're not around me, throw that to the side.
So you have T4-5 right here, the pleura. This is rib, intercostal space. You can see with every breath on the vent, full sliding all the way across means lungs fully expanded, no pneumothorax. We can go south one, north one, any one. Full slide again all the way across. If there was a pneumothorax, you would see sliding and then you would see a drop-off point where it was completely still. It's called the lung point. We're good.
Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. We count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows the angulation right here to bring in, is what allows the waistline to narrow. That angulation is maintained by wearing the corset. All right, finished doing our lipo with rib remodeling. We did the 9th, 10th, and 11th rib. We'll show you the CAT scan in a little bit. Sometimes you skip 12, but 12 is too short to treat. Expansion of the hips, buttock, prioritizing upper pole, the buttocks. You can see an improvement in the waist to hip ratio compared to our preoperative loading. Expansion of the hips, brought in the waist. You can see there's a nice improvement in the waist to hip ratio. Her BMI is on the higher side. So I was a little more conservative with the fractures. We didn't go as high as we can go for safety reasons. Gender-affirming surgery, round 2. We did further work on the hip expansion. Hip expansion is limited by skin compliance or how much you can stretch. So sometimes we come back to further modify or re-expand. Additionally, on the round 2, we did the ribs. You can say, why didn't you do the first time around? BMI was on the higher side. The BMI is in the mid 30s. I tend to stage it. I'd rather lipo first, clean up the fat compartments, and then come back and do a staged approach to modify ribs at that point to further bring in the waist. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.